Next up, to talk about why we are here, we have Charlotte Underwood. And Charlotte is a young person representative on the Greater Manchester Child and Wellbeing Board. She enrolled in 2013 as a medical student at St Andrews, beginning her clinical studies here in Manchester University. And she has a real involvement and interest around improving patient experience. Ladies and gentlemen, please join me in welcoming Charlotte Underwood. Thank you.
Thank you for inviting me to speak today. I am privileged to have been looked after by the NHS and its staff from the day I was born. I have received phenomenal care and support. However, today I'd like to highlight a few areas where the devolution of health and social care in Greater Manchester has an opportunity to make some positive changes to the experience that service users like me have. But firstly, I'd like to give you a quick summary of my background. I was born at 32 weeks at Bolton Hospital, but within the first 24 hours, I was taken to St Mary's neonatal unit in Manchester. Growing up, I've had numerous specialities involved in my care. When I was 16, while sat in a hospital waiting room, I saw a poster about a youth forum at Royal Manchester Children's Hospital. I applied and joined the forum while I learned I had a real passion for improving patient experience. Due to my work on the Youth Forum, I was invited to join the Royal College of Paediatrics and Child Health Youth Advisory Panel. Alongside advising the college, I've been given the opportunity to talk at national conferences and training days about how to improve healthcare and wellbeing for children. These experiences have given me a unique insight and interest in policy making within health services. In 2013, I enrolled as a medical student, and I am now a fourth year of clinical studies at Manchester. I was given the opportunity to apply to be on the Greater Manchester Children's Health and Wellbeing Board and was delighted to receive a place. And this is what brought me to be in front of you today to talk about my and other experiences of health services in Manchester. A challenge my family and I faced as I grew up was the navigation of the complex health service. I was lucky enough to have a paediatrician oversee my care from 13 to 17. It was really useful to have someone signpost me to various services. But even with this help, departments simply were not joined up enough, and it was easy to get lost. Notes were often not transferred, and this was very frustrating because I had to explain my full history every time I met a clinician. This disconnect between services was most acutely obvious for me during the transition between paediatric to adult services. This is something I would love to see improved, simply because it had a huge impact on young people's health outcomes. Often, transition takes place at an already chaotic period in a young person's life, with the tail end of puberty, finishing school, and next steps to college. Therefore, it's vital it's done well, or young people feel abandoned. Transition within mental health services has also been highlighted as an area that desperately needs improvement. I've spoken to young people where their transition has taken place overnight. This is not acceptable or fair, especially as these young people are especially vulnerable. The difficulties met when transitioning between services is not something that disappears when you get to adulthood. An obvious example is the movement from health to social services on complex discharge from hospital. Whilst on medical placement, it became very obvious that a lack of communication between these services seriously damages the patient experience. But with the devolution of health and social care, I feel we have a real opportunity in Manchester to improve this. It is estimated that 1 in 4 people in the UK will experience a mental health problem each year. This figure is taken from studies of people in private housing, so it is likely that the burden of mental health problems is underestimated. Importantly, 50% of mental health problems are established by the age of 14 and 75% by 25. These stark statistics show why we need early intervention. However, access to mental health services for most people is extremely limited, with waiting times often being cited as a major problem. It is important to remember that those with long-term conditions are 3 times more likely to develop mental health problems. In my late teens, I was lucky enough to be offered mental health support by the Cleft Lip and Palate Unit in Manchester if I needed it. However, I think I would have benefited from more emotional support during my childhood to deal with the problems I faced as I grew up. It is well known that building resilience in children is key for their well-being and helps them to overcome any challenges they may face growing up. Resilience is not innate, it's something you need to develop. So therefore, not only mental health services, but mental health and well-being education needs to be a key priority. This would mean the young people of Manchester will grow into adults with the tools to deal with the challenges of modern life. The importance of the need for resilience was highlighted by the tragic events at the MEN Arena May this year. An appreciation of the importance of education within health is growing. However, further emphasis needs to be put on this to empower the people of Greater Manchester to take control of their health. With an ageing population, many of whom have grown up with long-term conditions, the challenge remains to give patients the equipment with which to stay healthy. For me, this needs to start as early as possible, in schools, colleges, and reinforced into adulthood. An emphasis on prevention would hopefully reduce the strain on acute services. I am lucky to have grown up supported by my family who had some knowledge of how to navigate NHS services. When I think of all the challenges I have faced when accessing these, I cannot imagine how it must be for looked after children, those part of the justice system, refugees, or those that don't speak English as their first language. These groups are especially vulnerable and deserve extra support in accessing services. Inequality remains one of the biggest barriers to improving health and well-being of the population. Recently, work funded by the National Institute of Health Research showed that Greater Manchester has struggled in the past to reduce health inequalities. But local government, especially Manchester, where so much is now devolved, is well placed to tackle this problem, as many of the services that influence health and well-being fall within its remit. With the new opportunities devolution brings, the future looks brighter. However, this will require close collaboration between the GM Health and Social Care Partnership, the mayoral team, and leaders within the 10 local areas. Without labouring the point too much, I believe investing in the younger generation would be one solution to the growing problem of inequality, making sure that children and young people have a healthy and resilient start to life will only reap rewards for the health and well-being in adult and early life. So, you've heard from me, but I'm only one voice. There are 2.8, roughly, service users in Greater Manchester to be consulted, informed, and even employed by you. I will never forget the day a speech therapist turned to me in a multidisciplinary meeting and simply asked, "What do you think, Charlotte?" This meant so much to me and highlights the importance of empowering people. They want to be informed properly and how to look after themselves. One quote that always sticks in my mind from another young patient representative is "nothing about me without me." The value of your own and others' lived experience cannot be underestimated when designing services. I truly believe the only way to know what is going to work best is talking to and involving the people of Greater Manchester so they can be part of the plan of improvement. I'd like to leave you with 4 words that were picked by young people to represent what they think would improve health and well-being. Educate, engage, collaborate, and change. Educate people to empower them to improve their health. collaborate with those within your services, but also collaborate with other services. Engage people to improve their health and well-being, and change. Always think, what could be done better? Thank you very much.
Very well done.